Good afternoon, and thank you very much for joining me again today, 30 January 2020, and we're continuing to give you an update on the coronavirus that is wreaking havoc in China, and now it has spread to all the 31 provinces of China. And yesterday I explained to you that 6,000 people had been infected. Today, about 8,000 people are confirmed to have this virus in China. And yesterday I explained that 132 had died. As of this afternoon, the number had risen to 170. And I had explained that there are a number of countries which had the virus. I think it was about 9 yesterday. Now we're up to 20 countries. And the most shocking thing about today is that there is a cruise ship with 6,000 people in Italy. And this cruise ship, there was someone in there who was found with the virus. And now all the 6,000 people are being quarantined offshore, like I think close to Italy. This is a very serious situation with this virus because it is killing people and no one knows what can go wrong. If it spreads the way it is spreading right now, no one knows how this situation can go worse than it is already. But today I want to focus on the issue of the actual origin of this virus. Because the Chinese, according to reports, refused to release a copy of the virus. As you know, the Chinese were the first people to discover this virus at the end of December. But they refused to release a copy of the coronavirus to the World Health Organization. When they were asked to do so specifically, they refused. All they released was a picture of the virus. So up to now, it has not been possible to test for the virus. It has not been possible to work on a treatment or a cure or a vaccine for this virus because there has been no copy of the virus to work on. Only 2 days ago did scientists in Melbourne manage to get a patient who got the coronavirus, and then they started to work on creating a copy in a laboratory of this virus. So the scientists in Melbourne have finally succeeded in creating a copy of this virus, and they've started to send it across to different laboratories in the world. Now, the question you may be asking is, why would the Chinese refuse to hand over a copy of the virus? And the answer is very, very simple. In fact, I think there are two possible answers. The first answer is that the area of viruses and vaccines, it's a very competitive area, and a lot of resources go into discovering these viruses and mapping, what we call gene mapping. So the Chinese could be saying, we've put in so much work, we've put in all our scientists, we should benefit, we should have the advantage of creating the treatment for this medicine. Imagine how much money can be made if you have to provide treatment for billions of people. The problem is now it's possible that someone can create a virus and then they withhold the copy of the virus and only provide the treatment. We are entering a very dangerous territory if this is allowed to happen. So I think the World Health Organization has put forward a proposal to hold an emergency meeting where they will have to discuss these kind of things. What are the ethics behind keeping these copies of the viruses and not releasing them to other laboratories as a full virus, not as a picture? Now, the second reason could be even more scary. If this virus was created in a laboratory, maybe these guys are afraid that this will be reverse engineered and used to attack them by their enemies. Right, so there's definitely something there. The Chinese refusing to release a copy of the virus to the World Health Organization, choosing to keep the original copy and only give out a picture. What is happening with that virus? Now let's go to the second most important thing I wanted to talk about today, which is that countries are refusing to let people that have been in China into their countries. They're telling them to stay away for at least 14 days. So today we had Australia. They have put their people at what is called the Christmas Island. The UK, the plane was not cleared. It was delayed. So everyone is just sitting in the plane. I think that was since morning. And then we have a Canadian student. He went to visit the family of his girlfriend in Wuhan, and he can't come back into Canada. He's stuck now in Wuhan. So I've given you the numbers of how many people are sick. The new infections that we have. In Philippines, there are new infections. In Australia, I think there's 5 new infections. In Canada, and the first one in Africa, in Ivory Coast. Now let's look at the situation in China. So as I said, all the 31 provinces of China now have the coronavirus. And then many people who left Wuhan and went on holiday for the Lunar New Year, they cannot come back. There's no transport because aeroplanes are not allowed to fly into Wuhan. Then in terms of doctors, there is severe shortage of medical supplies. That has hit this province called Hubei. This is where Wuhan is. And doctors are wearing raincoats and plastics, disposable garbage plastics on their legs to cover and protect themselves. Australians wanting to leave Wuhan have to pay $1,000 to go and stay at Christmas Island for 14 days. This is almost like a penalty amount that you need to pay so that you can be accommodated in the Qantas flight, and then from there they'll put you at the Christmas Island for 14 days, after which they will drop you off at Perth and you will be on your way to your city where you are supposed to go, where you live. And then I've got another case here which is very, very interesting. A 44-year-old Chinese national from Hubei province arrived in Melbourne from Singapore. He was in a group of 8. They were traveling in a group of 8. And then when he was on the flight, he got sick. So he was going to the Gold Coast of Queensland on Tiger Airlines flight TT566. That was on 27 January, arriving at 8:45 p.m. Then he got sick. When he got sick, they discovered that he's got coronavirus. However, people had dropped off already from the plane. So they can't find these people. Imagine if these people got infected. How many people have been infected and how it's spreading there in Gold Coast, in Singapore, all these places where these guys went. It is chaos. Now, the 8 people that he was traveling with, all of them are in quarantine at Gold Coast University Hospital. 4 of them have fallen sick and are being tested for coronavirus. It's a very serious situation when you go in an aeroplane, and if this virus continues for more than a month, I won't be surprised if companies altogether ban travel by aeroplane. This is going to be a very big impact. So aeroplanes are the biggest danger. As it is right now, the biggest danger is aeroplanes. So the airline industry is on the verge of a lot of trouble. The tourism industry, this year is going to be their most difficult year. In Zimbabwe, I've got no updates. There's nothing that was said today in Zimbabwe that I saw, but I'll try to find something so that when I come tomorrow, we have an update. Right, so I'm going to end it here. The biggest problem that we have is that China refused to hand over a copy of the virus to the World Health Organization. Why? What is happening with that? That is the biggest question that I'm going to leave you with. But for now, thank you very much for watching. If you're watching this on a WhatsApp, please forward to as many people as possible. If you're watching on Facebook or YouTube, please like, comment, and share. Thank you very much.